So we have Ghalib from Written Medicine. Thank you so much for being on Product Demo Live.
No, thank you for having me.
Could you talk about the vision and mission of your company and talk about the product you're going to be demoing today?
Sure. So we're a company that's created a product around medication information accessibility. So I've got a background of community pharmacy, and we don't have any professional solutions to come over that communication and language barrier. So we created a software that translates and prints. Initially it was languages, but now we're doing stuff around pictograms for patients with learning disabilities and better quality English and standardized English and simplified English, but also in the future stuff around audio and to work with apps and stuff as well. So it's initially a product. We've got a platform which is a non-integrated product that they use in NHS trusts or in community pharmacies, but we also have APIs that basically creates a white label solution for system suppliers or healthcare organizations to utilize our content in however way they want. So if it's on invoices or it's on e-discharges or prescriptions or labels or text messages or on the app, it's entirely up to them.
Amazing. And so a Gujarati grandma could actually read her prescription and understand it. And understand the directions on how she should take the medicine.
So directions, indications, meaning what the medication's for, any warnings associated with those medications. So for example, simvastatin, is it supposed to be taken with fresh grapefruit, or amoxicillin you should finish the whole course, and rather than stopping it after 3 days and stuff like that.
So could you show us through your product demo?
Yes. Can you read any of those languages at all?
No, I can't. But you can just showcase the language.
So let's just go Arabic.
Okay.
So selected this language, and this is a patient medical record system that we've come onto. And if I scroll down, you can see all the previous history of the patient. And if I then translate something, just what medication should I translate?
Anyone you want. So let's just go with that. The Abacavir.
Abacavir?
Abacavir, yes.
So Abacavir, quantity, let's just say we're giving 28, and how do you want the directions of these to be?
What are the
one twice a day?
Yeah, we can do that.
Okay.
And so basically the pharmacy would be prescribing, is this what the pharmacy would see?
Yes.
Amazing. Okay.
Right, so there's the clinician facing side, and everything that gets printed out is the patient facing side.
Okay.
So we can do, so as I showed you, everything so we've got these, everything containing tape, so we've got more than just those 10, but we give the top 10. So take one tablet, or we can even do one T. That gives us the option as well, so I can select that and then remove this, and we are now and just say we want to give this for 14 days. And we can do, say, type hospital as directed by your hospital. Submit it, and then that's the direction of use.
Okay, and so this is the Arabic translation.
Yeah.
Wow.
So
okay.
Select that and PDF label this, and that generates a label which goes onto the pharmacy dispensing label.
Okay.
Or we can print out, just say select all, and print an A4 summary, and that goes straight to the printer. And that's got all their patient history, so we can select individual drugs that we want to print out via both label or A4, and the printout basically looks like this.
And so this is essentially what the printout will look like from the patient side.
Yes.
And this is amazing because I don't know, from my side, a Gujarati grandma can actually read her instructions, and then they're actually able to be independent as opposed to just having to pester their family to
exactly. But you got the confidential issues as well. So like ethnic minority patients tend where an interpreter professional is not available, that you'd have to utilize either a family or friend. And even if you can speak English well, you sometimes may have the ability of not reading it that well. Maybe you're not as literate in the language. So having that information in your own language may help, or or if you are you're okay with a family friend to help you understand information they can read the other in the other language, then they can help you give the better quality interpreting information from the translation itself. But confidentiality wise, at the moment patients have to forego it, and ethnic minority patients tend to have a higher proportion when it comes to certain viral infections, like hepatitis infections and stuff. And it's not because of lifestyle issues. It's actually sometimes it goes down to historic ways where they were given vaccines when they were in their native country. So in Egypt, in India, and other countries like this, when there were mass vaccination programs, they used to use the same needle on 30 people. So if the first person had a specific viral infection, like hepatitis or HIV, then the next 30 people are getting that as well. But they don't discover that until a good number of 30-40 years when they start developing cirrhosis of the liver, and which is normally associated with heavy alcohol consumption.
I mean, is this from a pharmacy standpoint? I mean, is this software easy to install on all platforms?
Yeah, it's you can use it off any web browser. Good web browser, and you're ready to go. Basically, we give you your own account. You create your password. And account verification process, and basically you're good to go. We can give you training online, or there's videos that we have already that we've created on how to use the software as well.
And is the database up to date with all of the all medicines generally?
Yeah, so with most common medicine, we've got roughly 7,000 drugs on the database, which we update every 6 months or even a quarter. So we've got that functionality already in the system. And
I mean, how are you pulling information from the patient medical record? I mean, is it already integrated?
No. So there's two ways. As I said, the non-integrated online portal, which is a standalone, so it's not integrated. So you have to do double entry of data into the system, but because it saves it, 70% of your prescriptions are repeat. So 70% of your patients are coming back to you. So you don't have to re-input that same information. It may just be you log in, go to the patient and press print. That's what you need to do. But we are integrating because we hate that whole double input of information, and we want to be integrated, and we are already. So this is actually I don't have it on here, it's on my other laptop. But just to show you, at Ealing Hospital or Norfolk Park, a Gujarati auntie can go in and get, or if she's an inpatient and when she's being discharged, she can get her new medication information in her own language in the discharge information. So we are integrated already, and we're currently integrating as well into our system.
Amazing. That wraps it up. For anyone that wants to leverage your technology, a pharmacy possibly, is there any way they can get in contact with you?
Yeah, they can go on writtenmedicine.com, so WRITTEN medicine.com, and contact either myself or my co-founder Murtada, and we can set them up an account, and we've got various different pricing points depending on the size of the trust, or if you're a single site independent pharmacy.
Amazing. Thank you so much for being on Product Demo Live.
No, thank you.
Brilliant.